It's also, when the liver breaks down the drug, it's also called hepatic metabolism, which may be something that you read and you're not sure what it means. And the older drugs are called enzyme inducers. They induce the liver to secrete more of these enzymes, and so they can become a problem. And your doctors are aware of it, and that's why you may speak to someone in one of the groups and they say, oh, I'm on this and it's working great, and then you go home and say, gee, you know, I wonder why I'm not on that. And it could be because of all of the other factors that are going into that person's care. It may be appropriate for them, but not for you. And it's, you know, it's a valid question. It's hard not to compare what you're going through when you're in a group. And, you know, everybody shares experiences, and hopefully that'll explain a little bit about it. So the older drugs are not generally considered the first line of therapy. In other words, it's not the first drug that you're going to pick from the list. And those drugs, there's 3 of them primarily: Dilantin, phenobarbital, and Tegretol. It doesn't mean that they don't work well, and if you're on them, they may work very well for you because you're able to take them and not experience the interactions or the problems with the liver metabolism. So in addition to the AEDs, there are also a few other types of drugs that are used. Decadron or dexamethasone, I think just about everyone is on. That helps to decrease the swelling in the brain and bring down the inflammation. And it's called a corticosteroid. And they also help to reduce the risk of seizures in the nature of their actions. They also have side effects, and I think that a lot of people that you may know, maybe you too, I mean, if you're on Decadron for a long time, you could get high blood pressure, you can have problems with your blood sugar, develop diabetes, but they're also used to reduce the swelling. So the proper administration of the medications and the potential side effects are very important. Good seizure control, it can significantly affect your well-being, your sense of pride in yourself and confidence. So it's very important. It's important that you take the medication the way it's prescribed, and if you have any questions, to ask about them. And because there are so many things going on and each patient's treatments are so complex, each person's got really an individualized therapy.